Hello, are you prepping for your NCLEX exam? If so, this is the video for you. We're going to look at 10 questions. It's going to cover cardiac, neuro, OBE, and infection control. At the end of each question, you're going to see the correct answer and the rationale. So are you ready? Let's go. Let's look at question number one. So question number one, a patient with chronic kidney disease reports fatigue and shortness of breaths. The nurse reviews the lab. It's hemoglobin of 7.9, hematocrit of 25, potassium of 5.1, and creatinine level of 5.2. So remember, this patient is chronic kidney disease. What intervention should the nurse expect next? So is it going to be A, the administration of epoetin alpha subcutaneously? Is it B, encourage high protein snacks? Is it C, restricting potassium to 20 milliequivalent per day? Or is it D, prepare for emergency dialysis? So I'll give you 10 seconds to select your correct answer, your answer. So in this particular question, the correct answer is letter A, which is the administration of epoetin alpha subcutaneously. So epoetin alpha is used to treat anemia secondary to a decreased production of erythropoietin in the kidney because of chronic kidney disease. With a hemoglobin of 7.9, it indicates significant anemia. Now, dialysis is not recommended yet unless the patient has symptomatic hyperkalemia or presenting with uremia. So let's go to our next question, number two. A patient with Parkinson's disease is newly prescribed carbidopa-levodopa. Which statement by the nurse or by the patient, requires further teaching? Is it going to be A, I will take this on an empty stomach to help it absorb better? Is it B, this medication might make my urine dark colored? Or is it C, I should report if I feel or experience uncontrolled muscle movements? Or D, this drug will cure my Parkinson's disease. So I'll give you 10 seconds again. Which patient statement requires further teaching? So the correct answer here, y'all, is letter D. This drug will cure my Parkinson's disease. So levodopa or carbidopa-levodopa helps maintain symptoms but does not cure the Parkinson's disease. Dark urine is actually harmless. Dyskinesia is actually a potential side effect of the drug. And taking on an empty stomach may improve absorption, but it also increases the incidence of nausea. So 2 questions up. We still have 8 to go. Right? So let's start with question number 3. A patient has a chest tube placed for pneumothorax. During assessment, the nurse notes the following. Which finding requires immediate action? Is it going to be A, continuous bubbling in the suction chamber? So remember, this is a chest tube connecting to a suction, right? B, serosanguinous fluid drainage into the collection chamber. Letter C, tracheal deviation to the opposite side of the chest tube. Or is it letter D, intermittent tidling in the water with respiration? So I'll give you 10 seconds to select A, B, C, or D. And once you select it, let's look at the correct answer. So the correct answer really is letter C, tracheal deviation to the unaffected side. So this is a concern because it's suggesting that the pneumothorax becomes a tension pneumothorax right now. And tension pneumothorax is a medical emergency. Continuous bubbling in the suction chamber is actually expected, and tidling is normal, and serosanguinous drainage is expected after post-injury. So let's go to the next question. A pediatric patient with sickle cell anemia is admitted with pain and swelling in both hands and feet. Which nursing action is a priority? Is it going to be A, apply cold compress to reduce inflammation? Is it B, start IV fluids and administer pain medications? Is it C, place the child on bed rest with legs elevated, or is it D, obtain a blood sample for type and cause? So I'll give you 10 seconds. So remember, this patient has sickle cell anemia. So let's have that 10 seconds timer. And then when you're ready to lock in your answer, lock it in. And so the correct answer in this particular scenario is the administration of IV fluids and pain medication, which is letter B. So remember, sickle cell anemia can have what we call vaso-occlusive crisis, which is treated with aggressive hydration and pain control. So administration of cold actually can exacerbate the sickling. So we want them warm. Bed rest may be helpful, but it's not a priority, and blood is not routinely transfused unless complication starts to be evaluated or rises. Okay, so next question. A patient with history of heart failure is admitted with confusion and muscle weakness. These are our lab results. You have sodium of 122, you have potassium of 4.0. Look at the BNP, which is 940. Which medication is most likely contributing to the low sodium level, which is 122? Is it going to be A, lisinopril? Is it B, metoprolol with the letter C, um, furosemide, or letter D, spironolactone or aldactone? So let's look at it for 10 seconds. And our 10 seconds is up. So in this particular question, the correct answer is because of the administration of Lasix. So Lasix, when we give it, it's a loop diuretic. It increases urine output, of course, right? And it also, in that situation, we also lose sodium together with water. That's the contributing factor of that hyponatremia. Aldactone is a potassium-sparing drug, so unlikely to have issues with sodium. And ACE inhibitors and beta blockers do not actually cause hyponatremia. So let's go to question number 6. A patient with type 1 diabetes is found confused and diaphoretic. The glucose reading is 42. What is the nurse's priority action? So is it letter A, we check the glucose in 15 minutes? Is it B, call the provider immediately? Or is it C, administer the 20 ml D50? Or is it D, encourage the patient to drink a lot of water? 10 seconds. 10 seconds. And 10 seconds is the correct answer is, of course, the administration of D50. This patient is already becoming unconscious, and a blood sugar of 42 is very, very low. So we're having this altered mental status, which is a medical emergency. The administration of D50 would be the best option in here. Of course, with the idea that there is already a doctor's order. Question number 7. A nurse is assessing a patient with increased intracranial pressure. Which findings require immediate action? Is it A, a temperature of 100.4? Is it B, a pulse of 58? So is it C, a blood pressure of 180 over 60? Or is it D, unilateral pupil dilation? So you have 10 seconds. Remember, increase ICP and the Cushing triads, right? But we have 10 seconds coming up. And so the correct answer for this one is letter D. That dilated pupil that is only on one side suggests already herniation or brainstem compression, which is life-threatening. So the Cushing triads that I was talking about is composed of bradycardia, hypertension, and irregular respiration. Is also a concern, but less specific than acute pupil changes at this time. Question number 8. So let's go to OB department. So a postpartum patient who delivered 2 hours ago reports sudden chest pain and shortness of breath. What is the nurse's priority action? Is it A, encourage deep breathing and coughing? Is it B, apply oxygen and raise the head of the bed? Is it D, administer a PRN opioid for pain, or is it D, check for uterine firmness? So this is 2 hours full stop. You have 10 seconds. So the correct answer is B. Apply oxygen and raise the head of the bed. So sudden chest pain and dyspnea postpartum suggests pulmonary embolism, medical, which is a medical emergency. In the choices that we have, letter B is the best correct answer. Administration of oxygen and positioning in perfusion. However, we know that it's going to go further than this. Question number 9. A patient with COPD is receiving 4 liters nasal cannula, 4 liters oxygen by a nasal cannula. The nurse notes increasing shortness of breaths and a respiratory rate of 8. What is the nurse's priority? So is it A, prepare for intubation? Is it B, decrease the oxygen flow rate? Is it D, stimulate the patient to increase rate? Or is it D, continue monitoring for 30 minutes for this patient? So 10 seconds. So our correct answer here, y'all, is decrease the oxygen flow rate. So remember, COPD patients rely on hypoxic drive to breathe, right? When you have 4 liters nasal cannula, that's too much oxygen and it suppresses this drive. So one interventions that we could do, of course, we have to monitor after we're doing this intervention, is to decrease that oxygen flow. And last question for today is a patient on contact precautions where C. diff infection is discharged. Which action is most important before preparing the room for the next patient? Is it A, spray surfaces with alcohol-based disinfectant? Is it B, wipe the bed and side rails with bleach solution? Is it C, remove linens and send to central laundry supply? And letter D, place a terminal cleaning sign on the door. So all choices are really correct, but there's one that's the most correct answer. So lock your answer in 10 seconds. So the correct answer here, y'all, is wipe the bed and side rails with bleach solution. So C. difficile have spores that are resistant to alcohol. So that's a no-no, right? Bleach, disinfection are required to kill the spores on the surfaces. Terminal cleaning should follow, but disinfection with bleach is the priority at this time. So how did you do? Please share your score in the comments section, and thank you for watching this is my first in this channel for the Nursing Student Avenger. Thank you. Please subscribe to this channel. See if we can get this channel going. Thank you very much.